Okay, you're welcome. This is medical ward, and you're welcome.
At Naguru Hospital in Kampala, trainee nurses are reporting for their first ever shift.
You can go, we take our buckets, our cleaning.
Task number 1, cleaning the ward. It's not glamorous, but the new recruits are keen to learn the ropes.
It's good to know that a patient can depend on you, like you can help them to give them life again. Like they can make you know that this nurse can help me with this. Yeah, it's good.
Uganda needs them. The health system is chronically understaffed and low pay is forcing people out of the profession. Despite this, the government is planning to send 3,000 to Britain and the Middle East. It says it doesn't have the resources to offer them a job here. So all of you, if you get the opportunity to go apply the UK, you would go?
Yeah.
Yeah? No, you wouldn't think about it. The nurses in this hospital are very keen on the idea of working in the NHS, but there are warnings that recruiting staff from developing countries like here in Uganda creates a brain drain that's putting patients' lives at risk. In rural areas, the situation is reaching breaking point. This clinic in Mayuge district serves 250,000 people with just 2 doctors and 6 nurses. As the head nurse, Tracy, begins her shift, patients have already been waiting hours. Many won't get seen today. The birth rate here is high, and women who come for antenatal services must often sacrifice an entire day.
You'll be there from 9, sometime up to 10 p.m.
In the evening?
In the evening.
Sometimes you wait for 12 hours or more.
So for this one,
Despite the challenges, patients appreciate the dedication of Tracy and her colleagues.
So she's saying whenever she feels like she needs to consult, she always calls on me, and then I come around and explain to her and reassure her of the health of the child.
With the system on life support, health charities are sounding the alarm. Peter Echeru is part of a medical monitoring group. The issue that keeps cropping up, too few staff doing too much work.
This is the it's been on duty from 7 p.m. yesterday. She's still here at the duty station.
So you've been working for 18 hours?
Yes.
Now it's 1 o'clock, you started at 7.
I started at 7 p.m.
How many babies you delivered over the 18-hour shift?
5.
5 babies?
Yes.
But sometimes you go beyond 5 on some days.
Sometimes, some days, some others are so many, you can even deliver 10.
10
yes.
in a shift?
Yes.
Delivering 10 babies in a day is over 6 times more than the WHO's recommended safe limit for midwives. Rachel Days. In Peter's view, sending nurses to Britain is the last thing Uganda should be doing.
So the UK hiring Ugandan health workers is going to have a catastrophic effect on already challenging health system. You're not going to pick away the ones from the university. The target will certainly be those with experience. And those with experience are already in the public service delivery system. And so what that means is that you're taking away not just human resource, but you're also taking experience from the public health delivery system that we have. And so that is catastrophic.
After finishing her shift, Tracy heads to the fields. Her wages, the equivalent of £400 per month, aren't enough to support her 4 children. So she tops them up, growing maize and sugarcane. So you're doing like 2 jobs?
Yes.
Isn't that tiring?
It is a little bit tiresome, but I have to make ends meet. We cannot support the family if we depended on salary alone.
Yeah.
The salary is not enough.
Losing someone of Tracy's experience would be a massive blow to the community. But with nurses able to earn 10 times more in Britain, the temptation is huge. your patients who you have been serving for years, wouldn't they be sad?
They'll be kind of...
They'll be losing you.
Yeah, they will, but they will understand it, that there are times when you have to be with someone, and she was trained to work, not to work specifically in a specific community, but to work anywhere in the country or anywhere in the world.
So you would consider going to the UK?
Yes, if there is an opportunity, I would just take off.
At Kampala airport, Ugandans queue up to leave the country. An agency has found them cleaning jobs in the Middle East. In the local language, those who go and work abroad are called unkubacheyo. It means fortune seekers. But for Uganda's own fortunes to improve, its people must believe they can build a life in their homeland.